Sorry, not a good start. I think I got stuck in my throat. Warm welcome. I guess good morning to most of the people on this call, as we expect most people to be from North America, but a warm welcome and good evening to anyone from Europe joining us today. I'm assuming our Asia Pac colleagues are all fast asleep. We'll just give everyone a few minutes to join us before we kick off, just to make sure everyone knows that they're in the right place. Today's Galen Growth analyst briefing is focused on US health systems, and more specifically, what these guys are up to in digital health. So, let people join us. Give everyone a couple of minutes, and then we'll go for it. Okay. Hoping everyone will attend as opposed to just wait for the recording. It's always more fun to have some live questions at our analyst briefings. This is a particularly fascinating one, I would suggest, simply because today, really, most people have been talking about digital ventures and pharmaceutical companies and those kind of things. But very little have we seen at the topic of what US health systems are doing, particularly when we bear in mind the US health system are really the backbone of delivery of healthcare in the US. So what these guys are doing in digital health has to be looked at very closely. People are slowly joining us. We do know that it's spring break, I think they call it in the US, Easter break here in Europe, and therefore we probably won't get everybody joining us live today, but the more the merrier. So listen, warm welcome once again. My name is Julian Salaberry. I'm the CEO and the founder of Galen Growth. Galen Growth is the most trusted digital health intel and insights firm. We work with a great deal of blue chip clients, from pharmaceutical players to medical device players to large consulting firms to financial services institutions, big tech, etc. Our global reach includes US, with our team in Chicago, in Europe, the team in Basel, and in Asia, with the team in Singapore. We built Health Alpha, which is now really the world's leading digital health private market data, intel, and insights platform, which is subscribed to by large industry healthcare players and other verticals, investors, as well as leading startups. It is the leader because of a number of things. One, we have more ventures than anyone else. There's 14,000 visible and another 2,000 currently going through curation and verification before we go live. We have now a industry standard taxonomy, which means that our search engine is aligned to the way in which our clients look at the vertical, as opposed to generalist platforms where you've got to find the name of the startup before you can start getting some data on the startup. That means that productivity using our platform is unmatched, and we saved our clients 170,000 hours of research time last year just through the use of the platform. And of course, all that is supported by our unmatched expert team, including Sarah, who is with us today. The platform powers all our thematic reports, including this one. So you will get a first-hand visibility of the sort of data that we do capture, but also the way in which we categorize the data to help our clients use it. So today's focus, as I said earlier on, US health systems and, of course, their digital health achievements to date. It is the first ever baseline of US health systems and their activities in digital health. It is a snapshot of the 60 plus pages of data, which can be found in the report itself, and you can download this report, FOC, on our platform. If you are looking for it because you haven't yet got a copy, then strongly recommend just go to the Galen Growth Research page, click on the icon for the report, and just follow the journey. Scope of analysis, same for us as usual. All digital ventures incorporate after 2002, private, And of course, we looked at Asia-Pac, Middle East, Israel, Europe, North America, and South America in our analysis. And you'll understand why when we go through the data. Please feel free to ask questions. Use the Q&A button. It helps us understand that it's a question as opposed to chit-chat between people on this call. But we welcome the questions. It makes it a lot more interesting and provides us a sense of how you're looking at the ecosystem. So Sarah, welcome. Thank you for joining us from your own holiday location. So thank you very much for making the time to brief everyone on this fascinating topic. Let me hand off to you because I'm sure you want to give us a bit of context before we step into some of the key data points.
Yeah, I think Julian, you did a good job of describing the activity going on a little bit in U.S. health systems and hospitals. I'm happy to be here today. Thank you to everyone who's joining us. Our motivation behind this report is really that we looked in Health Tech Alpha, our digital health intelligence platform, and what we found is there are over 560 health systems and hospitals based in the US that are partnering with digital health ventures, right? More than 560 entities, right, that have formed more than 1,400 partnerships, right? There's a lot going on in US health systems when it comes to digital health. And you hear about that too. This started really during the pandemic, of course. You heard, okay, telemedicine, like they're all moving to telemedicine. You're getting a lot of telemedicine apps coming in and supporting, right, to help the healthcare or the sick people stay out of the hospitals, right? And when you see in our analysis that we're going to give, we can confirm that, right? A lot of the hospitals and health systems are partnering with telemedicine or teleconsultation ventures. But then you hear things like, hey, the health systems want to partner with digital health or bring digital health in to reduce health equity gaps. Well, fact is, we don't really see that in our data. They want to implement remote monitoring, right? Digital therapeutics. These are all things we've heard about in the news, but what we're going to say is this reality? And we can show that through the data we collect. Our report is based purely on data, on facts, and we've mapped the portfolios, right, of the 10 largest health systems in the US, as well as the 10 most active health systems in the US, right? In addition to that whole 560 other entities that are hospitals and health systems, right? So we really focused in to understand who's doing what and the zoo. And doing this, we can kind of remove all that spin. We can reveal data that you can trust and look at what are the facts. Right. So that was our motivation here. What are the facts? What's really going on in US health systems? So let's start with some simple numbers. Let me get over my technical difficulties here. There are globally, there are over 1,600 hospitals and health systems that are active in digital health, right? This is across the globe. 35% of those are located in the US, right? Not real surprising. This is a good split, but that's a big chunk of who's interested in digital health, right? But if we look at the number of new partnership announcements by year in health system location, you see this growing interest and the growing activity, right? Partnership activity going on between health systems and digital health, right? From 2018, you have 51 partnership announcements going through 2022 last year. Right, almost, yeah, there are over 400 partnership announcements going on. 72% of those announcements were all with health systems in the US, right? So what you see is health systems in the US are very active and they're becoming more active in the digital health areas. So that's fantastic news, right, for the US health systems and for digital health both, because really this means you're getting the solutions into the hands of the physicians and the patients, right? Overall, the top 65 health systems have created more than 50% of the partnerships, right? So there is a broad spread of health systems that are active here, and this is out of 560. So you're looking at a little more than 10%. But in reality, only 10 health systems in the US have made more than 15 partnerships or have a digital portfolio of more than 15 partnerships. So that's where you see the field of activity starts getting quite small. The pie chart on the right is looking at corporate partnerships for US venture. So this is flipping around and looking from the side of the venture, right? What's been going on. And the US ventures are 31% of the partnerships that have been announced by US ventures are with healthcare systems, right? So there you also see within the US itself, the largest share of partnership announcements, 31% have been with healthcare systems, right? So it's exciting. Julian, on to you. You were at Vive last week in Nashville, Tennessee, and you were able to meet and discuss with some of the healthcare leaders, some of the CIOs of the healthcare systems within the US. What was the buzz? What was going on? What was being discussed there? What are the latest trends? Oops. If you take yourself off mute, we'll be able to understand you a lot better.
Sorry, I did indeed mute myself. Yes, absolutely. Gail Gross was at Vive 2023 only a week ago in Nashville, Tennessee. First time I ever went to that city. And it's on the back of course, HLTH took place in Las Vegas last year. Mixed feelings. For those of you who watched the news, certainly the first day was somewhat marred by the sort of very sad news of a school shooting at a school in Nashville, which did sort of put a slight dampener, I guess, on the whole of that day. But it was great to see a room full of health systems, and more specifically, of course, their innovation teams, for those manning the booths, as well as CDOs, CTOs, and CIOs of the health systems who were there presenting their points of view on various panels. And a room full of digital health ventures, as well as other service providers to health systems. So a good buzz. The organizers claimed 7,500 people had participated. And so we did see a lot of people there. And the Gale and Growth team was able to engage with a lot of people. Listen, the themes are very consistent in terms of the conversations we had with the leaders or the leadership teams of these health systems. Certainly they've all come out of COVID suffering, a vast cost managing their way through COVID, and most of them were, I think, hoping for a bit of rest and respite coming out of COVID. But of course, I guess inflation and a very tight labor market has continued to push their cost base up. And so what they are describing, I guess, is that the digital front door, which was a kind of a buzzword that we could hear described in the pre-COVID years, is really hitting them now hard in terms of they need to find ways to improve their overall value chain through technology. And so they are fast tracking a number of their ambitions when it comes to digital health. Although the point you made was very valid, and that is that there seems to be, at this stage, a reasonable gap between what are described as their, I guess, key objectives, strategic objectives, in terms of the overhaul of their value chain and what they're actually doing. Mindful of the fact, of course, that this baseline, the first ever baseline of health systems and their activities in digital health in the US, is really historical. So we're looking at the rearview mirror here, and we should see, therefore, based on what we heard at Nashville, different behaviors and different levels of engagement going forwards. Somewhat mirrored by, of course, for example, the 15 or so deals that General Catalyst signed with 15 distinct US health systems across the US. So that's, I guess, one indication of the appetite they have for this. We can step through some of those objectives that were, I guess, outlined through our conversations with health systems, but I don't want to get too far ahead of the presentation flow that you have in mind, Sarah, for us. Very happy to answer some questions as well.
Thanks, Julian. Yeah, let's look a little bit deeper into what you're talking about, because you started talking about the General Catalyst agreements, let's say. Mm-hmm. And what we found when writing this report is that there's a 2.1x difference in the top 10 largest health systems, their activities in digital health, and the top 10 most active health systems and their activities in digital health, right? So there's this big Grand Canyon kind of, let's say, between the two, right? The top 10 largest health systems, looking a lot at, HCA healthcare, and the large systems that have, and those are top 10 by number of hospitals, by the way, according to Becker's hospital review. They have a lot of rural hospitals, right? These are the ones that are feet on the ground, getting the work done in the rural areas and in the larger parts of the US, or the larger geography in the US. Let's say that much. It's not necessarily in the big cities. The top 10 most active health systems, and I can pull up, I'm gonna switch over to the other presentation real quick and pull up some of this list. These are, we're looking at a lot of research hospitals, right? Really focused on the cutting edge, getting new technology into the market. And these are the ones that tend to be the top 10 most active hospitals. Topping that list is Mayo Clinic, right? And on the right, you see this comparison of strategic areas. We looked at 5 different strategic areas for health systems. The first being prevention and wellness. Second are diagnosis tools. That includes teleconsultation, by the way. Treatment and adherence. And right, so patient solutions and the treatment after the diagnosis. And then the fourth area being infrastructure. So the hospital infrastructure and physician education, looking more at, helping not only a hospital run more efficiently, but also looking at the personnel, keeping the personnel, supporting them. And then finally the research tools, including clinical trials and research tools. So the top 10 largest health systems, yes, their portfolios are smaller, so all the bars are lower. That's fine. But the two big differences you see are, first of all, in the diagnosis, right? The most active health systems are using more diagnosis tools to do based on genetics and other automated image analysis and that type of thing. And then the other big area that's very different, of course, is in the research bar, right? Those two bars are very different between the largest health systems and the most active health systems.
Certainly that came across as well at Nashville, because really health systems were present, not individual hospitals, although there were members of, for example, Mayo at Vive, sorry, I keep mispronouncing it. That research element is certainly very unique to teaching hospitals versus health systems as a whole, absolutely.
Right, and that's where I wanted to show, if you don't mind me jumping over to in fact our report. What you saw is looking at some of the profiles we have. Okay, first of all, the top 10 largest health systems and the most active: HCA Healthcare, VHA, Common Spirit Health, Ascension, topping the list of the largest in terms of number of hospitals, and then the most active: Mayo Clinic, Mount Sinai, Cleveland Clinic, Boston Children's, right? So those are the names you see. And when we look at, for example, Mayo Clinic, right, the most active, who have the largest portfolios, that comes out, whereas the research part is nearly 20% of their portfolio, right? Doing the clinical trials, right, using digital tools for clinical trials, and also a lot of the research part, as well as the diagnosis. What really was astonishing, and I'm not going to jump back here into my in my presentation, was the prevention and wellness part. We did not see the representation in any of the portfolios of the prevention and wellness. So was there any discussion about that? Any potential there that might pick up in future?
So yes, and you're absolutely right. So we at Galen Growth, in our conversation, we're trying to come up with what were the key themes we were hearing from the CTOs and CIOs, and then trying to link that to, of course, our best-in-class industry standard sort of categorization of digital health, to try and map it a little bit. And just to drill into the point you just brought up. So wellness prevention solutions seem to be far more in their minds as it address their own staff than patients. It is this sort of concern around labor shortages, but more importantly, burnout. And therefore, how do they leverage digital health to monitor and help manage their mental health, wellness applications as well, to try and help their staff, I guess, stay operational and stay 100% to continue delivering healthcare. So that tended to be the direction of conversation when we looked at those specific type of categories, let's say, in digital health.
That makes sense. Makes a lot of sense. So the other thing that that we looked at within our analysis was when you have that the difference in the large portfolio size versus the small portfolio size. There's a lot on this slide. We can't go through it all exactly in this webinar, but what I want to point out is these are the 5 strategic areas that we were talking about. And when you look at the largest portfolios, right, the health systems that have the largest portfolios, what you see is what's really covered is that research and clinical trials. Almost 100% of them have, or 100% have bioinformatics, right? And nearly more than 80% have other research clinical trials tools. That's also disease management, digital therapeutics. And really, digital therapeutics is a good example. When you go left, right, when you go to the smaller portfolio size, it nearly disappears, right? So the smaller hospitals haven't gotten into digital therapeutics at all, right? They've not been proven enough. They're not jumping into those areas. But what the smaller, if you have kind of the minimum viable portfolio, you could say, what it likely has is teleconsultation. As we know, result of pandemic, disease management, and there's a lot of prescriptive analytics going on, right? Helping to guide the healthcare professionals based on big data to say, okay, what's the likelihood of a disease or likelihood of what's the next steps they should take. So those are really the 3 top areas as far as the minimum. If you have a big portfolio, you can have everything you want. You can see the 100% at omics-related diagnosis, the medical imaging, disease management, and digital therapeutics, right? So there's a big difference in the bigger portfolios, but you do see the disease management, prescriptive analytics, teleconsultation as being present in a lot of even the minimum portfolios. So that's the focus. And if we get into the area of digital therapeutics and some of the more disease management and those type of ventures, those are solutions that really require evidence, right? Evidence, some sort of clinical evidence that their solution is valid for patients or that improves the outcomes for patients. And the strategic areas research has the highest percentage of ventures that are actually have a clinical or an evidence signal greater than 40. And at Galen Growth, we look at clinical trials, we look at regulatory filings, not including FDA registrations. We don't look at those. Leave those out. We look at regulatory filings, clinical trials, and peer-reviewed publications in order to give the venture an evidence signal score. And if that score is over 40, we say they have established some sort of clinical evidence that their solution has a benefit for the patient. And looking across the 5 strategic areas, of course, research, 69% of those ventures have the evidence signal greater than 40. Right. So it's a large number. It's a large percentage. That means it's a venture that has a solution mature enough to really be showing and proving that their solution works. And that proof is most evident in ventures that have remote devices, ventures doing clinical trials, solutions, as well research solutions, and then wellness and patient solutions. That wellness includes wearables, by the way. So that's what pushes the number up for wellness. And I know, Julian, in the news, you hear a lot about ventures you hear a lot about clinical evidence now, and and the ventures and health systems, I can imagine, can't be any different, because if they're working with patients, they have to have solutions that have evidence that really work.
Sure. I mean, listen, it's very increasingly important to them. I think it's always been important to them, but they are very aware of and cautious of claims being made by innovators versus delivery. Now, of course, it's going to vary depending on what they're trying to overhaul in their value chain. So, if you talk to them about, talk to the CTOs and CDOs, CIOs as well, some of their focus on improving profitability, and that's much more around, how do you essentially improve margins, digital payment systems, those kind of things. And then, of course, it's not clinical effectiveness, or strength is certainly not appropriate. But then you get into the topic of augmenting patient engagement, things like health at home, which is all around telehealth, remote patient monitoring, etc. Then they're much more aware of and attentive to, and wanting to understand a bit more about clinical evidence. But they're also aware of the fact that this is something that will grow in importance as well as in terms of proof points. And some of it is because they've not been particularly demanding for it. Some of it's because the innovators haven't really pushed for it. But there's also this awareness that governments are only really starting to roll out the frameworks for regulatory approvals, as well as, of course, reimbursement mechanisms, and therefore what you need to prove for that. So it depended really on what the burning platform was for that CIO or CTO or CDO for that health system, depending on what conversations we had with them. One topic actually that bubbled up that doesn't affect clinical effectiveness at all, but isn't on that chart that you were showing before, largely because I think it's in that grey zone, is there were quite a few conversations about cybersecurity with some of these CTOs. I think there's a growing awareness that greater, their systems are archaic often enough, still using fax machines to move medical records around. But more importantly, they know that the more they get into health at home, the more they get into remote patient monitoring, etc., the more they're going to have that impossible word to pronounce, the interoperability of data, and therefore need to keep a very close eye on what their cybersecurity strategy and technology is going forward. So we should probably also see a growth there going forwards as well.
Yeah, I think it's an important discussion to have, because there's a lot of hesitance within patients, right, to use the solutions due to exactly those reasons. So in Health Tech Alpha, we look at ventures focusing on cybersecurity, right, to understand what are the possibilities and what is the new technology coming up in that area.
Yeah,
I think it's a very important topic. And now what also plays into what's going on as far as whether or not that venture needs clinical evidence, because you see here the 5 selected digital health clusters that really have the most clinical evidence is as well the therapeutic area. And I say that because if you look at the top therapeutic areas by the number of partnerships with US health systems, right? The top area are the disease agnostic ventures, right? And that's a lot of it, that's because we see health management solutions, right? And there's also the clinical trial solutions. They don't have a specific disease area, so right, so they're disease agnostic. And looking, going down to the bottom, matching up, you see health management solutions, telemedicine, population health management. Those are the top 3 clusters within disease agnostic solutions. But once you get into the more in-depth therapeutic areas, the second, third, and fourth areas are oncology, women's health, and cardiovascular disease, right? These are the second, third, and fourth top therapeutic areas for ventures partnering with US health systems. The top cluster for all 3 of those therapeutic areas is medical diagnostics. So if you're doing a medical diagnosis, you absolutely need evidence that your solution benefits the patient, right? You can't have a solution that hasn't been proven yet. And that plays a lot into whether or not those ventures have clinical evidence. Oncology and women's health, second is research solutions, helping improve the research in that area. Cardiovascular, in second place, pulls up the remote devices, right? Being able to remotely monitor patients and the health of their heart. And then finally, oncology is health management solutions. Women's health is in clinical trials and cardiovascular patient solutions, right? Looking at the fifth therapeutic area is mental health. And there you have a bit of a different perspective on it. First is the patient solutions, and this includes digital therapeutics and includes disease management solutions, and then telemedicine and wellness solutions. Right. So like you said, Julian, there's a lot. The need for clinical evidence really depends on which areas you're looking into. And by the way, mental health, I'm not saying they don't need the evidence, but I was talking to someone last fall at a conference, and she was talking about how hard it is in mental health solutions to get that clinical evidence because the procedure isn't quite as clear. So that may be why we don't see in mental health quite as much. Now, Julie, I'm very curious to hear your take as to what was discussed at ViVE as far as the funding downturn, right? Because I know at Galen Growth, we've been tracking very carefully what's been going on here, and you were looking into it in particular, Julian. Was there a feeling of panic as to whether or not ventures will be getting funding, or what was the atmosphere there?
Mixed bag will be the answer to the question, Sarah. Listen, talking to health systems, there's a small level of concern that some of their partners, digital health partner innovators, partnerships might struggle, and therefore they may need to work out how to get involved. Talking to the ventures, again, mixed bag, although I think people's minds got a little bit focused when Ali Parsa, CEO of Babylon, who was at ViVE, was, I think, in an article in a popular British newspaper called the Telegraph, talking about his cash crunch. And then that was published, I think, on the Monday morning of ViVE kicking off. So I think that focused a few minds. And of course, it comes on the back of Pear Therapeutics that, of course, the week before had only just been talking about the fact that it's putting itself up for sale. So we got the sense that it's starting to focus people's minds, and I mean, sooner rather than later, in view of some of the data we've seen, we dug into a few of the VCs we came across, and so asked them a few questions. I guess they're in some pain, the VCs. I've seen an interesting headline kicking around, the VC party's over. Provocative, but I think, they're having to deal with a fair amount of pressure from their LPs, so that their own investors, who are starting to look for cash returns, with, of course, a shift in the climate, in interest rates, and of course, the likelihood of some stress in the startup scale-up environment. Some of it, of course, accelerated by the SVB, Silicon Valley Bank upset. I think a lot of LPs are shifting, from what I can see, their money out of VC into private equity, who are much more skilled at dealing with assets under duress, assets in distress, and of course picking them up for a song with a view to build them into a bigger business, or even potentially dovetailing it into an existing business, for example. Let's not forget a fair few PE firms sitting behind some of the private hospital groups. So I think there's pain there, which is also being compounded by the fact that, of course, most VCs have been promising very high IRRs, the rate of return. But I think the performance of the portfolio invariably has not yet met these type of promises, and therefore there's going to be some hard conversations with some of their LPs. But we've done the analysis. We know that globally, and of course the US picture is slightly more positive, but the US picture is that some 25% digital ventures in the world have actually raised funding in the last 18 months as at the 31st of December. Now, I will let you talk about the US picture, which I think is much better, Sarah, or more positive anyway. But listen, we've got to be clear here. The funding production line is clearly constipated. There's been no IPOs for quite some time, which means that there's no obvious, it's like a conveyor belt, really. There's no obvious movement of the asset to the next seniority of funding. And therefore, any rounds, from what we understand, talking to investors, are going to be flat, if you're lucky, and more likely to be a down round, if you're, again, lucky to get some funding as well. So there's going to be some deep discounts on previous rounds. We've already heard that during the course of the back end of 22, where we were hearing that valuations of late stage was as low as 50% cut on valuation. So I think we'll continue seeing that downward trend. But I was going to connect it back to what you were saying earlier on, Brady. Certainly VCs that are specialized in digital health are looking for the proof points. And the two important ones are clinical evidence, which you were talking about a minute ago, and a reimbursement. Has that venture got a route to reimbursement? They are pushing hard for their portfolio to do cost cutting. And I won't revisit the Pair Therapeutics and Babylon stories, but those really are focusing people's minds. And certainly we at Galen Growth continue, even after the conversation we've had in the last few weeks, including National Vive, continue to expect venture-to-venture M&A to grow in importance, which is something I think we'll be able to report on very soon again.
Yeah, absolutely.
So a mixed bag, basically. Yeah. Sorry.
Mixed bag. But like you said, when you look at the U.S. health system, the partnering that they're doing, 31% of the digital health ventures that are partnering with health systems did raise in the last 12 months. So they should be feeling a little bit comfortable, at least for the next year, that they have some cash in the bank. But looking down towards the red, what that means is 50% or nearly 50%. 45% didn't raise in the last 18 months, right? So it definitely needs to be top of mind for health systems when they're partnering, making sure that their partners are financially stable. But we still have that 31% who should be comfortable, right? So it's a good discussion to have, and will be interesting to watch in the next in this over the course of this year. That we don't want to end on a negative note. So Julian, I think our time's getting short, so let's.
It is. We've got no questions, so keep going.
Okay, good. So let's wrap up here by again emphasizing, right, the number of partnerships that are being announced is growing significantly with U.S. health systems and ventures. Now, if you look at the full report, the ventures that U.S. health systems are partnering with, they're not only U.S. ventures, right? They're looking across the entire globe to choose their partners. The majority are still in the US, but still you have a global representation. So there's a lot going on. There's momentum building, right? And there's a lot of focus by those US ventures of getting partnerships within the hospitals and health systems, right? So we look forward to continuing this report for sure. Julian, like you said, looking at how that portfolio is evolving, right? What's going on in the last 5 years versus, or say 10 years versus, what are the partnerships? What does that portfolio look like in the last 2 years, and how is that changing year to year? So,
no, absolutely. I mean, if you come back to your opening data point, which is, that 30% of all partnerships signed by a digital venture has been with the US health system in the last 12 months, or certainly in 2022. I'm fully expecting this baseline to shift, particularly along some of the key themes that we were talking about earlier on.
Great. Do you have any questions yet?
No, I don't have any questions. It looks like you were crystal clear.
Fantastic. The report is online, free to download. I encourage you. There's a lot more data in the report, so download that, and you can have more data than you can handle. If you have any questions going forward, you are very welcome to email research@galengrowth.com. Email Julian if he wants to give you his email address, or myself. A lot of you are clients or know Galen Growth personally. Okay,
Absolutely.
so encourage you to download the report. Look forward to discussing the next report. When we are focused on oncology across the globe. And Julian, any closing comments?
No, thank you to everyone for your time today. We are, as Sarah said, available to answer any questions. Feel free to download the report if you haven't already, or certainly to look at the data on Health Tech Alpha. Just create your own account and browse. You'll find, for example, a workspace that is dedicated to health systems for you to look at. But I think it's an exciting space, particularly US health systems and everything we heard in Vive. And so looking forward to continue to track and monitor this ecosystem, so to speak, over the next 12 months, see how it evolves. Thank you very much to everyone.